Welcome, everyone, to another episode of Arthritis at Home. Today, we're looking at lupus, a chronic disease that can happen in any part of the body, including the heart, brain, kidney, skin, and affects over 1 out of 1,000 Canadians. People with lupus can experience a butterfly rash on their face, kidney problems, and even brain involvement such as seizures. These differences make diagnosing lupus challenging and living with it different for everyone. Join us today to talk about lupus are Leanne Mielczarek, Chief Executive Officer, and Heather Coates, National Fund Development and Engagement Officer from Lupus Canada, who are going to help us learn more about lupus and more about the Lupus International Congress that was recently held in Toronto. Leanne and Heather, welcome to the show.
Thanks, Kelly. Thanks for having us.
I think to get us started, maybe I'll ask you to describe to our audience what are the main types of lupus?
There's a few main types of lupus. One is systemic lupus, which mainly affects the organs. There's cutaneous lupus, which affects the skin, and that's where you see people with rashes and whatnot. They can be on any parts of the body. There's also drug-induced lupus, which is caused by certain medications.
And when we think about the prevalence of lupus, who gets it? Is it uh, disproportionately affect men or women? Who gets it?
Yeah, lupus primarily affects women and usually in those childbearing years. However, having said that, we see men and children also being diagnosed with lupus, and we're seeing more and more children being diagnosed with lupus. So it is a disease that can affect anyone, anytime, and any organ. But we see more prevalence in women during those childbearing years.
That's interesting, Leanne. What special challenges are there for women and pregnancy and lupus?
Yeah, well, they have to always be careful. They always have to consult their healthcare team before they decide to go on that sort of journey and look at having a family, just to make sure where they're at with their lupus at that point in time, what medications they're taking. Usually, they like them to be in a relatively healthy space. But it's definitely something that they need to talk with their healthcare team about before going down that road.
You mentioned medications. How is lupus treated?
Lupus is treated primarily by, up until I would say 2011, it was treated from medicines that were not specifically created for lupus. So we have a number of different medications. You'll see hydrochloroquine, you'll see prednisone, and anyone who knows much about prednisone, that can be really harmful to the body as far as you can really balloon up and it can be hard on organs and also your physical nature because it can really cause that sort of balloon face effect. Um, we also are now seeing new biologics in the last, since 2011, we've seen two new biologics specifically for lupus, which is very encouraging and very hopeful for the lupus community. And we're also seeing through these biologics a lot of success, and people are being able to manage their lupus a little better.
That's probably a nice entree for us to look at your experience at the international conference that was held in Toronto on lupus, in particular as it relates to some of those treatments that you're talking about, treatment guidelines. Um,
Mhm.
can you start by just telling us generally what was that experience like being with some of the smartest people dealing with lupus from around the world?
It was incredible. It was an incredible experience. We had the opportunity to meet with so many fantastic folks, experts from across the world, and to really better understand the synergies of what is happening for lupus, and the challenges in each of the different regions across the globe. We were fortunate enough also to interview global experts while we were there, and I think we interviewed like 16 different global experts from Japan and Spain and the US and so forth. And um, it was incredible to learn from them where they feel we are in the lupus space. There's so much hope for lupus right now because we're seeing so many new treatments in the pipeline from different groups that we have never seen before. So to be in this position right now is really quite incredible. When we speak with folks, when we were at Lupus 2025, the messaging was always of hope. Everybody was extremely hopeful. And they talked not only about remission, but they started to actually have the conversation around cure, which that to me really says a lot for where we are in the lupus space.
Well, you did mention that there have been two advanced therapies since 2011 introduced to treat lupus patients, and that certainly is well below the treatment armamentarium exists currently for rheumatoid arthritis or ankylosing spondylitis or psoriatic arthritis. So there was a lot of catch up with lupus. So it's really, really exciting to hear
Mhm.
um, that there is this incredible amount of research and innovation happening around a disease
Yeah.
that has been relatively uh, not treated in the same way with the
Mhm.
same amount of options as some of these other types of inflammatory arthritis. So that's really, really exciting to hear. So you were also active that so you just weren't attending sessions, but you're doing these interviews with experts. Was there any other programming that you were conducting while you were at the conference?
Yeah, I can take this one, Kelly. So Lupus Canada had a booth in the exhibition hall, which I think conventionally speaking, you sort of think about what does that mean? And in this case, it meant amazing FaceTime with specialists and partners in the lupus space. So it was an incredible opportunity to get that face-to-face interaction, to actually interact with patients who are at the heartbeat of the conference. There were patient sessions throughout, and so much of the approach for this particular international conference was patient-informed strategy.
Mm.
So it was incredible. It was 4 days of speaking to, as you say, like the brightest minds globally who are spending their time and talent researching, discovering, and furthering um, treatments in the lupus space.
I think it's an important reminder for our audience that when organizations like ours attend these conferences, it's not just being an environment of shared best practices as it relates to, clinical practice and treatment, but it's also best practices in terms of patient organization, education, and advocacy programming, and be able to learn from others. So, really, really valuable. What I'll ask both of you then, what were maybe some of these key takeaways, either on the research side or on the education advocacy best practice side, that you're going to be bringing back to your organization and sharing with your key member and key audiences?
Yeah, there was a number of key takeaways, but I think the ones that stood out for us, and Heather touched on it just a moment ago, was around the emphasis on the patient voice. That was a really important piece at this Congress. We heard it over and over and over again from folks saying that this is one of the first times they've seen how important that is, and we need to continue that, to have that patient input. And we've seen that too with when we're trying to encourage whether it be the CDA or PCPA to list drugs on formularies, having that patient voice, the real life experience, the quality of life. We also, there was an emphasis on the critical role of the collaboration on a global perspective. So
Mm.
that continued working together across the world to really learn from one another and bring everyone's research studies together so that we can really learn more. And as I mentioned before, one of the really important things that we heard was that sort of global shift from remission to cure. So to be even speaking about that was such a critical turning point for me, at least, to know that that is potentially on the horizon. We don't know when, but at least it's being spoken about now.
So that message of hope that you're going to be able to share with the wider Canadian lupus
Yeah.
community, obviously a very powerful message.
Yeah.
What are some of the ways that you are going to share some of this knowledge and experience with that lupus community? I'm just thinking in terms of obviously people can go to your website. We're going to have a link to your website at the end of this episode. Are there other ways that you're going to share this information and people can be looking out for some of that news coming out of the conference?
Yeah, so we are developing advocacy campaigns focusing on improving patient care and equitable access to care. Um, so and coming out of this Congress, all of our learnings will be incorporated into those advocacy campaigns. We're
Mm,
also going to be sharing those videos that we have been interviewing with folks, and we've been doing that post Congress as well because unfortunately we only had 2 days. We just couldn't fit everybody in, so we're continuing those over the next 2 weeks. So and really fascinating to have those conversations with folks so that we can bring that information back to our lupus community. We're creating short sound bites, key messaging, really optimizing that social media messaging to share with our community that this is a time of hope for those living with this disease. And we're doing that through all social media mediums, whether it's YouTube, Facebook, LinkedIn, Instagram, whatever it may be, also through our website, and really touching on all those different platforms so we get the messaging out through our monthly e-newsletters as well. And speaking with patients, we interviewed one patient. We have a couple more to interview to really share their story from point of I think I have lupus to the diagnosis journey to living with lupus and what does that look like, to be able to share that with the community and to continue to engage our lupus community through interactive digital content to continue to foster that dialogue and support.
great. Heather, anything else to add before we wrap up?
I do think Leanne covered most, if not all, but I do think, just reiterating the heartbeat of all of this is really patient outcomes and improving those outcomes. So the patient voice is a non-negotiable as we move forward. It needs to be part of the conversation. And then the collaboration piece, I would just say that one more time. And we were lucky enough to meet up and have that FaceTime with other patient groups. And some of them were um, smaller scale even than Lupus Canada. One that sticks out in my mind is the patient group in Ghana and the
Mm,
advocacy work that they're doing there.
mm.
Just seeing those synergies where, I get it. Our challenges are different, but the intent is the same. And how are we getting through to policymakers, whether it's in Ghana, whether it's in Canada? And I do think, like, again, that's why these conferences are so valuable because we can share our best practices with them, but it's also it's shared with us as well. They've done incredible work and they have moved that dial in Ghana so far that it's just inspiring to see that collective work, even though it's happening in separate countries, can be a shared effort. And I think that that's what really stands out to me after coming back home and having a chance to reflect on it.
Mhm.
That's fantastic. And again, we encourage people at the end of this episode, we're going to have a link to your website. They're going to be able to learn more about that experience that you're describing. Also, I think it's appropriate that ACE and Lupus Canada also send out a little teaser to our audience, and that is in terms of synergy, in terms of capturing that heartbeat. Lupus Canada and ACE are going to be collaborating on a project this summer, and it will look at that lived experience, try and capture that patient voice from a lupus perspective. So we're really, really looking forward and excited about that collaboration, and that will form the basis for another Arthritis at Home episode where both of us can be talking about our common project that's going to be happening soon. So looking forward to following up on that, and really, really thanking you for sharing your experience today, talking about lupus, talking about that conference. So significant that it was being held in Canada, a really proud moment for, I think, a lot of stakeholders in Canada who work in the field of in lupus. So thanks to both of you for joining us today.
Thank you for having us.
And
Thank
of
you,
course,
Kelly.
thank you. And thanks, of course, to our audience. We hope all of you can join us again for another episode of Arthritis at Home. Bye for now.